quite some time. I did
the resident and the pain medications are helping it. Morning, y'all. So today is Thursday, February 20th. I'm going to be having clinic in the afternoon today, so that's going to be my shift for today. But before we do all that, I have a morning report with one of the second years. We're going to be talking about multiple myeloma and some other spectrum of diseases. And then in the afternoon, around noon, we're also going to have a ventilator talk by one of our ICU doctors. After that, from 1 to 5 p.m., then I'll have my clinic, but I kind of have some things beforehand. I just finished up my workout. I am on my deload week, so it wasn't too hard. I've been feeling a little bit meh. This morning I woke up kind of feeling a little groggy. I went to bed a little bit later than usual. I try to go to bed by 10 p.m., but I don't know, last night I just got distracted. So hopefully I can kind of knock off some of this rest today and get throughout the day. I'm feeling like I'm having not the best hair day. I just untwisted my 2 strands of my barrels in the last night, but it's kind of just all over the place. I'll probably just slick it back so it's just not all on my face. But other than that, gonna knock off this rest, eat my breakfast, and jump all the way to work. So let's go ahead and get it. We just finished morning report representations with Justin. He presented on multiple myeloma, MGUS, monoclonal gammopathy of unknown significance. It was a pretty good, interesting case, and we had our oncologist there, and it's nice to have our oncologists and specialists to kind of give us internists what we should be thinking whenever we get cases from their type of specialty. So that was a nice little learning case. I'm glad that we did it. All right, pretty productive day. We had a morning report with my resident Justin, and then we also had a ventilator talk with our head of pulmonary and ICU here. So I'm headed to clinic right now, a couple minutes late, but I'm going to be working with the residents and seeing their clinic patients. So our system here for clinic, it's a 3+1 system, meaning that the residents see the clinic patients every 4th week of their rotation. And usually interns have about 3 to 4 patients, maybe up to 5 by the end of their first year. The second years have to like 6 to 7. And then the third year residents, before they graduate, can see up to 7 to 8. Usually in the actual clinics, when you become a clinic doctor in the outpatient setting, you can see up to 10 in a half day, so like 10 in the morning, 10 in the afternoon. So it can be a lot of patients, and we try to simulate ramping up the amount of patients that they see throughout the day. So for me as the attending here, because we have a residency program and the residents see the patients on their own, they go talk to them, they figure out what's going on, and then they come tell me what's going on as a supervising doctor. And then from there, they tell me their plan and what they want to do. And then I have to be the one that decides, okay, that does sound like a good plan. That doesn't sound like a good plan, or it sounds like we need more information. Let's go talk to the patient together. And then after we see the patient, we make sure we do the physical exam, tell them what the plan is, and then we tell them we want to follow up in like a month, 2 months, 6 months, whatever it is. Usually there's about 5 to 6 residents in the actual clinic setting while all this is going on, and about 40 to 45 patients spread amongst everybody to see those patients. These are what our actual clinic rooms look like. We got our computer station over there so we can chart. We got the bed over here in case the patient wants to sit there and we want to do some physical exams. And then we have all of our gloves, disposables, little things to check our eyes and nose. And then just some places for, the family to sit, or if the patient wants to sit, if they don't want to sit on the bed. And then, of course, you got to be able to gel in and gel out just to stay sterile. So we are about 2 hours and 50 minutes into the shift. We usually end our clinic days, it's 2:51 right now. We usually end our clinic days at 5 p.m. or at least no other patients can be scheduled after 5 p.m. Usually people stay after the fact just to finish up notes. Sometimes appointments go a little bit longer, so we don't like to just cut off our patients. We like to actually address all of their needs because it does take a long time to actually get into our clinic system, and it is pretty impacted. So when they do get here, we want to make sure we address all their issues. Usually each appointment is dedicated to be 30 minutes. You don't really sit in the whole room for 30 minutes because you do need to staff with the attending, and then you do need to go back and talk with the patient. So oftentimes you spend around like 15, 20 minutes, talk with the attending for about like 3, 4, 5 minutes, and then try to go back and educate the patient before they leave. We have about 2 more hours before the shift ends, and then after that, we'll probably just go back. For me, when patients are seen by the residents and they write their notes, they put me as the co-signer, meaning that I'm the one that supervised them. So I have to go through their notes, make sure that what they documented was correct. If it wasn't, I send it back to them and tell them some feedback to change up that note. Or then I sign the note, put my own attestation and my interpretation of what's going on. That way, when they're seen again in the clinic, they can read that attestation or read the note as well and make sure that everything is followed up on appropriately. This is Kasum.
Hello.
She was my MA when I was a resident here.
First year.
Yes, we were a power team.
I know.
They couldn't stop us.
And after that, they took you.
They took you away from me.
Yeah, and they gave it to Judy.
They said you were too efficient. We gotta separate you guys.
I know.
No.
And you are like always in advance, try to send me an extra thing to do.
That's why we were leaving early.
Whole week you try to do everything.
I know. And then they told me the rules.
And what they told you?
They were like, relax.
I don't know. He's always sending me 1 week ahead. I'm getting behind, so yeah, that's a good at least.
I'm just trying to be forward thinking a little bit.
I know. Yeah. That's the way it's supposed to be.
Yeah.
In advance, like
Exactly.
that's why today you're precepting. You start precepting.
Now I'm precepting, Yeah, I love it. I'm always appreciative, Kasum.
I appreciate it too because you're doing really good job.
I try. Whew, okay, we got about 40 minutes left, y'all. We are going to be wrapping up, make sure people get their notes in, make sure everybody gets their orders in. I think one of the biggest lessons that I learned when I was a resident in the clinic setting was that a lot of the issues that we see in the inpatient setting can be avoided if you do the proper maintenance in the actual outpatient setting. It's a little bit difficult in the outpatient setting because when you're in the hospital, you're seeing them day after day after day because they're hospitalized. But for people in the clinic, it can be difficult because sometimes you see them and then you don't see them for another 2, 3, 4, 5, 6 months, even in like a year. So a lot of times it's a little anxiety provoking that we see a patient and you don't really know when you're actually going to see them because people miss appointments. People are not like in a controlled setting, like in the inpatient setting. So I do want to advocate for a lot of you guys to take those clinic appointments seriously. If you're a patient, definitely let your doctor know what's going on so we can kind of address everything in the moment, because life happens and you never know what's going to happen further on down the line. And sometimes you just maybe forget at the next appointment. And then if you guys are doctors, make sure that you are addressing all of your patients' needs. You are your patient's biggest advocate, and you really want to make sure you're addressing everything that they want to address and not rushing them through the appointment. I know it can be stressful having all these patients, people showing up late, and then, you know, patients' appointments going overtime, and then other patients get upset because you're coming to their appointment late. But it really is worth it to address all of their problems in a manner that they're going to be happy with as well, because they're just going to come back another appointment with that same issue. So why not just address it in that moment? I think the most important factor in clinic as well, and not even just clinic, just medicine in general, is just making sure that you're not using a lot of medical jargon and you're actually using language that the patient can actually understand, because a lot of patients will just say yes, they understand, when they really don't understand. So you really want to use as simple language as you can. I believe doctors or my attendings in the past told me, if you were going to explain this to a 5-year-old or someone in high school, how would you actually explain it and talk to them in that manner instead of saying all these big medical jargons? It can be difficult because we use that medical jargon when we're speaking to each other as physicians, but then when we actually go talk to the patient, make sure you code switch and actually talk simply and plainly as if you're talking to a family member. That way they can understand and go about their life knowing what they should be doing for their medications, their plans, and so on and so forth. So be your patient's biggest advocate and make sure you're explaining to them and keeping them in the loop. So clinic is over. I'm heading back to the office right now. I really enjoyed clinic today. It was actually my same cohort of residents that I graduated with. I was in cohort D, so we have 4 different cohorts that are rotating through the clinics, which is why we have a 3+1 schedule. So there's always a cohort in clinic, and it was just kind of nice seeing the transition of seeing the interns that came in with me when I was a resident now becoming seniors and becoming more responsible and more being full-fledged doctors. So it's kind of nice seeing how you pass the torch down and seeing them progress and them passing the torch down as well. So I'm gonna head over to the office, pick up my stuff, head home. I don't have a morning report tomorrow, so I'm probably gonna just sleep in a little bit and then come into the office and do my administrative things with the other chiefs. Yasmin, how's the rest of your day?
It's amazing. I'm about to have an espresso shot and continue working.
Yasmin actually has her own diabetes clinic, which is pretty cool. Has any previous chiefs done that before, like their own diabetes clinic? She is the first of her kind. So every Tuesday in the afternoon, she has her diabetes patients come in. It's kind of nice having someone like that. So you wanted to do a diabetes fellowship? Yeah, so we'll see what's in store for her next year. More to come. Of course, I always forget where I parked, but anyways, heading home right now. The last thing I'll say is that if you guys are medical students, I dropped 3 videos on UMSMLE Step 1, 2, and 3. So if you guys want advice on that, you can go check them out at the end of this video.